All right, guys, this is Health Nibble number 79, and
Woohoo, 79.
79, and I'm going to do a little series on diabetes, and it's following our block fast, which block fast is, one of our solutions. So what I'm going to do is first give you a little history, and then just talk about the mechanisms of diabetes. So and there's a guy named Dr. Jason Fung. He's an expert in diabetes, and
Slow network.
what's that? The network?
Oh, still. Second. There you go.
Is it going to piece it together?
Yeah, there you go.
So he's an expert in diabetes, and I'm going to try and explain it the way he does, and he actually, my doctor group trains with him. So basically he gives a historical perspective that diabetes was originally, we had kids that had high blood sugar, and they couldn't, so if you look at the cell.
Hope is your pen running out?
Well, pen's running out. And then they had high glucose. And the problem was they couldn't get this glucose into the cell. And they couldn't do that because there wasn't any insulin. So this was a case where the energy is high, but you can't get it into the cell, so basically the kids kind of waste away and they died. So then in 1921, they invented insulin.
Which is awesome.
Which is awesome, because then all of a sudden they can save all these kids. So then in the 50s and 60s, they're monitoring blood glucose, and they're seeing that these high glucose levels in people that are not, kids that are dying, but actually overweight adults that have fat around their liver, fat around their pancreas, fat around their abdomen. And so unfortunately, they don't know what to do with it. So they start using this same strategy where we tie it with insulin and force it into the cell. So they thought the idea is if we control this glucose in the bloodstream, then we're good. No matter how much insulin we put in, no matter what the person's eating, if the blood sugar levels look good, then we're good. But the problem is it's, as it was with the kids, it's not a situation that you can't get the sugar into the cell. What's actually happening is, obviously it's not an energy deficiency issue because, overweight, fatty organs, fatty liver, fatty pancreas, all that. It's a situation where the cell is full of sugar. So rather than addressing the issue specifically with sugar, what happens? We take medicine, insulin and other meds, to keep cramming. It's like it's the lock and key model. So the lock is the receptor and the key is the insulin. So it's like, hey, this lock isn't working. So what do? We throw a bunch of keys at it. And it actually works. So, if you think of it like a suitcase, the suitcase is the lock and the sugar's the close. And, when you're cramming it in there, you're the insulin. Well, if you keep cramming it in there, it's going to overflow, right? There's a point where it fills up and then it overflows. So that's what happens. So you get this spillover, and then all of a sudden, the glucose in the blood vessels increases again, all right? So what do? Keep shoving it in. So, and then it starts circulating. Eventually you can't keep shoving it in, and it starts circulating around the body. So it starts affecting the eyes. So it lodges itself in places, the blood vessels, the feet, the hands. And then it goes to the liver. So you get fatty liver. And then the liver packages this thing up. So the liver takes this glucose in, especially like high fructose corn syrup, and then it puts it in takes that energy and it converts it and puts it in little packages of fat, and it puts it all over the body. And when it also puts it all over the organs. So that's a different type of fat. That's why with diabetics oftentimes have visceral fat, which is something we address directly in our lectures, and we do a really good job of shrinking that visceral fat on our weight loss side and on the Midwest Functional Health side. But it does all of this stuff, but the problem is, okay, you test your blood and it looks good, but everything is rotting. So you're getting diabetic neuropathy. So are you healthy? No. So another good analogy that he uses is, if you think of your body like the kitchen and the sugar is your trash, you want to get that sugar out of the body. So you want to get that trash out of the kitchen. So what, the other approach is with just managing it with meds and insulin. It's just like shoving the trash all over the kitchen. And so
Like the cabinets, under the
sink. And the cabinets, in the corners, under the sink. Well, eventually that's going to fill up, and then it spills out, and then over time it rots.
But your kitchen's clean, right?
The kitchen looks clean for a while, but then everything starts rotting, and that's when you get neuropathy. So it doesn't even make sense. It's not a root cause approach. What we do is a root cause approach, which is take that trash and get it out of the kitchen, right? So take that sugar and get it out of the body. So in 2008, In 2008, they did a study, actually a handful of studies, and they evaluated, okay, is this approach working? So when we control the blood glucose levels, are we decreasing heart disease and heart attacks and strokes and neuropathy and all of these things? And the answer was no. So they unfortunately with those studies, and I'm going to stay in my lane. I'm not a pharmaceutical guy. I know there are pharmaceuticals that can actually pull that sugar out of the blood through the mechanisms of the kidney. I'll look that up for you guys if you're interested in that. But I always talk about we have hunter-gatherer genes, and with those hunter-gatherer genes, historically, if your blood sugars would rise, your kidneys have a threshold and it'll dump it out into the urine. That's a protective mechanism of your body. So it doesn't make sense to most functional medicine doctors to take drugs to keep shoving it back into your cells and then spill into all your organs. So what's the solution here? It's pretty simple. Get the trash out of the kitchen, right? Get the sugar out of the body. How do you do that? You don't take it in. And clearly, based on our fast and the way that we live, very little sugar. You don't need sugar to live. So, and an analogy we've used, since like early 2000s when lecturing on nutrition, I always say, what do you feed cows to make them fat? Most farmers know that. You feed them grain. You feed them corn, because corn breaks down to sugar, sugar spikes insulin, and you create a diabetic cow. But you kill them before, you butcher them before they have a chance to get neuropathy and cancer and heart disease and all of that. So same situation here. What's the solution? Don't put the sugar into the body. That keeps the insulin levels down. If you have that situation, you actually burn that, get it out of the body, and burn the fat, which is what we do both on True Weight Loss, successfully on True Weight Loss Solutions and Midwest Functional Health. Lots of cases on True Weight Loss Solutions, we just focus on the food, and we've had multiple situations where we've reversed diabetes just with food. Midwest Functional Health, a lot of times there's some toxicity issues involved. There's probably toxicity issues in the other one. They're just not so toxic that they can't reverse that. But either way, we evaluate the patient.
A lot of times people can't lose the weight.
Yeah, a lot of times
they're so toxic.
Yeah, so the toxicity creates a weight loss resistance issue. And so anyway, we address those appropriately. But the health nibble of the day is just giving you a background on diabetes and the current approach, and that the point is, if your parents were diabetic and you're diabetic, I'm telling you, you can reverse those epigenetics, you can reverse that genetic expression and reverse diabetes. It is possible. So that's your health nibble for the day.
And stay tuned for the series, because it's a
Type
really
2
good
diabetes.
one. Yeah,
Yep.
this is type 2 diabetes, and this is a really good series, so tune in.
And the point is, if you have type 1, and the pancreas doesn't work at all, that's a different situation. Mm-hmm. But you can also, in that situation, lower the amount of insulin that you take just by living the way that we teach. So
Okay.
I'll stop.
All right, we'll see you tomorrow.